Hi guys, I'm Katie Tam, and today I'm going to be talking to you about exercise and aging. And we're going to talk about what happens when we age, the impact that exercise will have on the aging process. Then we'll get into the different types of exercise, why each is important, and why we should have a varied approach to exercise. We'll even get into how those exercise protocols will change as we age, and then get into some sample workouts. So essentially, aging is just a gradual decrease in our physical and mental capacity. We start to have a growing risk of disease, ultimately death. But these changes are not linear or consistent. A lot of times people will think, well, I'm just aging, so things are going to decline. That's not necessarily true. You can see there it's only loosely associated with a person's aging years. So it does depend largely on how well we take care of ourselves throughout our years. Obviously, there's other influencing factors in this, like genetics, race, gender, social and environmental factors, chronic illnesses, and lifestyle. So we will hit on mainly the lifestyle side of things because this is the things that we can change. So again, not necessarily a linear process. We can definitely slow that process down, or even, I don't want to say reverse it, but we can mitigate some of the things associated with aging, at least the negative things associated with aging. So, one of the most common changes is in our cardiovascular system. Our blood vessels start to stiffen, our arteries start to stiffen, which makes our heart work harder. Um, our heart muscles change to adjust to that increased workload. So then our heart rate at rest will stay about the same, but it won't increase during activities as much as it used to. So that can put you at an increased risk for high blood pressure and other heart problems. Then we have our bones, joints, and muscles. So with age, our bones tend to shrink in size and density, so that weakens them, makes them more susceptible to fracture. You might even become shorter. Our muscles are generally going to lose strength, endurance, flexibility, which can affect our coordination, stability, and balance. So um, the next one is our digestive system. There are structural changes that can happen with our large intestine, which can result in more constipation. Um, so the other part of that too is we tend to not eat as well as we get older or as we age. So a low fiber diet can contribute to that as well. Maybe we're taking other medications, supplements. These can also contribute to digestive issues. And then the next one there, bladder and urinary tract. So our bladder could become less elastic as we age, which can cause us to need to go to the bathroom more often. And our pelvic floor muscles can also become weaker, which again can contribute to bladder issues or not being able to empty your bladder completely. Men could also have an enlarged or inflamed prostate, which can again make it harder to go to the bathroom or empty your bladder. Memory, this is one a lot of us we already associate with aging. So our brain undergoes changes that have minor effects on our memory or thinking skills. So, for example, it might be harder to remember familiar names or words, might be more difficult to multitask. Then cognitive function can also change due to injuries over time, such as a stroke or mood disorders like depression. More on that later. And then our weight, so our metabolism slows down as we age, and then we also don't necessarily do much strength training as we age, and that's where if we have less lean muscle mass, our metabolism will slow down as well. So we talk a lot about strength training later into this presentation, but our metabolism actually slows down starting in our 20s, but it continues to decrease by 2 to 3% every 10 years. So that also starts, in our 30s, we start to lose muscle mass as well. So it can be 3 to 8% per decade after the age of 30. So that's why you're going to start seeing it be harder. Maybe you're already seeing this, to lose weight as we age. And then you're going to start seeing maybe more body fat in your midsection as well. So that really does happen when we start to age. I know a lot of people come in during health coaching and talk about it and being frustrated with it, but it's definitely real for them. And then sexual health, a lot of factors can mess with just being able to enjoy this part of your life. Whether it's dealing with ED and just not being able to do the things that you'd want to do. And then there's other conditions down there: ears, eyes, teeth, and skin. Those aren't necessarily ones I'm going to be hitting on because that is a different route. Whereas ones that I have listed here, exercise can actually help them. So I will get into that as we go on through the presentation here. So this is just showing you how most of us are not hitting the recommended amounts of exercise per day or per week, really. 150 minutes of exercise of cardio is recommended per week, and then 2 times a week of strength training and daily flexibility or balance type exercises. So you can see almost 50% are not sufficiently active to achieve any health benefit, and then 80% of people don't even meet the normal standards. So it's definitely a problem. I know most people can focus on the nutrition side of things when it comes to their lifestyle because it's a little bit easier for them to do and focus on, whereas exercise kind of just gets put on the wayside. So I wanted to kind of kick off how exercise can change aging with this Dallas bed rest and training study. It was a study done in 1966, or started in 1966, I should say. They took 5 healthy men. They were age 20. They were asked to spend 3 weeks resting in bed, doing absolutely nothing. And as you can see there, after 3 weeks, they had a faster resting heart rate, which can lead to higher blood pressure. They had decreased heart pumping capacity. They had an increase in body fat and a decrease in muscle strength. So no surprise there. So then what they did was they put them on an 8-week exercise program, and it pretty much reversed all of the deterioration that they experienced in those 3 weeks. So then 30 years later, they were evaluated again. So at age 50. Over time, these men gained some weight. They had some decreased cardiac functioning just from normal aging. So they were asked to follow a 6-month regimen. So a lot more time at this point, versus that 8-week study, but they were also aged 50. They didn't want to put them through anything too strenuous. But again, they did see with that consistency over 6 months of time that it reversed the effects of aging that they had experienced over those 30 years. So again, it is just a testament to how exercise can maybe reverse some of the effects of normal aging that we all experience or expect to see. So by now, we know we can't prevent ourselves from aging, but we can slow down those effects. We can ward off potential health threats by being active. It will play, a critical role in just having a better end of life. And people who exercise regularly, not only live longer, but they're going to live better. So you're going to enjoy those years. So let's kind of go down this list a little bit. And these are associated with the first common aging complications that I mentioned about, like heart health, your bones, your joints, things like that. So the first one there is reducing the risk of heart disease. So exercise is going to, lower things like triglycerides. It's going to lower LDL. It's going to make your heart stronger. It's going to increase your HDL, which is your good cholesterol, which you can think of as like the maintenance crew of your heart. So this is going to be mainly found through like cardio type stuff, getting your heart rate going. You can do walking, swimming, running, honestly, anything that you enjoy doing that's going to get your heart rate up is what I would suggest doing when it comes to trying to reduce that risk of heart disease. Blood pressure, so again, your heart is working more efficiently when you're exercising regularly and consistently, so that's going to lower your blood pressure. Blood sugar, that exercise improves your body's cells' ability to use insulin, so it's going to help with regulating those blood sugar levels. Obviously, we know that exercise can lower the risk of obesity, it can increase muscle mass, so that's where, if we're strength training, we'll talk a little bit more about that as we go through the presentation. Strength training is going to increase your muscle mass. When you have more muscle mass, you're going to have a better metabolism, and that can help with lowering your body weight. Obesity or being overweight is essentially a risk factor for everything, so the more we can manage that, the better. Muscle mass too, I should go back to that. When we're stronger and have more muscle mass, it's going to help with preventing things like falls, fractures. You can remain independent as we age. If we talk more about memory here, that when we're exercising, it increases the blood flow to our whole body and including our brain. So there are studies out there that show we have better brain function when we are exercising regularly, and it's helping reduce stress and depression, and those two things definitely affect our memory as well. And I skipped over mental well-being there, but when we exercise, it releases, feel-good endorphins and other brain chemicals, and that can help protect our brain from dementia. So it just helps with, reducing the deterioration of our brain. So if nothing else, you can help with cognitive function when you're exercising. Reduce the risk of osteoporosis. So this goes with bone, joint, and the muscle health that I was talking about earlier. If we are doing, weight-bearing exercises like walking, jogging, tennis, weight training, it's going to help build strong bones. It's going to slow the bone loss, and it's going to maintain muscle mass. So it's just going to help you live longer and live more independently as we age. You're going to be able to move a little bit better, bend over and tie your shoes, be able to walk upstairs. So, also in there for stretching, we're going to be able to have joint flexibility. There's just, there's a lot of benefits to there's a lot of benefits to exercising to remaining independent as we age. Cancer. So exercise lowers the levels of hormones that are associated with cancer development and progression. So again, that is going to help with reducing the risk of cancer. Digestive system, I don't think I have on there, but I wanted to talk a little bit about because we talked about it on that first slide. It can help with, if we're exercising regularly, it can help with preventing constipation. It can also help with our bladder if we're losing weight. So exercise is going to help with losing weight. So it will help with incontinence. And then the sexual health that I talked about earlier, when we're exercising regularly, it really improves the release of sexual hormones. So again, that can help with pretty much everything that I listed on that first slide that's associated with, common aging stuff. So there's a lot of benefits to exercise. You just have to find out what your personal benefits are to make it more important to you. So let's get into the different types of exercise and why each is important. So endurance, that one I mentioned earlier, is going to improve like heart health, your lungs, your circulatory system. This is mainly cardio. Then we have flexibility. So that's going to make Your everyday activities easier. It's going to help you remain independent, as well as the balance exercises, which are going to help with preventing falls. And strength is going to increase your muscle mass. So again, it's going to help you stay independent and prevent fall-related injuries. And we're going to get into all four of these here. But first, we're going to start with endurance. So that's aerobic activity or cardio. I mentioned earlier that the recommendation is 150 minutes per week of moderate activity or 75 minutes of vigorous activity. The main goal here is to increase your heart rate. So there are all sorts of calculators out there that you can figure out what a good heart rate would be for you. It's all dependent on your age. So if you want to know what that calculator is, or what the equation is, or a good one to look at, just let me know and I can help out with that. But essentially anything that is going to get your heart rate up, so it can be walking, jogging, yard work, dancing, swimming, biking, stairs, tennis, or sport. It's got to be something that you enjoy though, that you will do consistently because again, these are very important to improve your heart health, your lungs, your circulatory system. They can, delay or prevent a lot of different diseases that are common, such as diabetes, cancer, heart disease. Even if you are not able to be active, all at once, you can break this into different parts of your day. A lot of times I've talked to people about just taking, 10-minute walks here and there during like lunch or during breaks. Just try not to sit as much during the day. Anything you can do to get up and moving. So this, again, very important, paired with other types of exercise that we're going to talk about. So here is a quick way to do it. Like I said, you can get a hold of me if you want to talk about it a little bit more, but it's important to calculate your target heart rate because if you're outside of that heart rate zone, you may not be getting as much benefit. Take that with a grain of salt. If you're going out on a walk and your heart rate isn't where it needs to be, please still go on the walk. But what you do is you take your your resting pulse. Once you figure that out, you will plug it into this equation down here. So it's 220 minus your age will give you A. Your resting pulse that you just took is B. So you're going to take that 220 minus your age minus your resting heart rate to get C. And then the 0.5 is 50%, and then the 0.85 is 80%. So you want to be within 50 to 85% of that target heart or of your heart rate range to get some benefits there. If you're over the 85%, you're going to be working too hard. If you're under the 50%, you're not working hard enough. There is a simple way to do it. It's called a talk test. So if you feel like you are out doing something and you can speak poetry very easily, then you're probably not working hard enough. But if you're out on a walk with a friend and you can barely form any sentences and you can only say one or two words, you're working too hard probably. So there's a middle ground there where you can talk a little bit but not easily. That's one way to do it. So strength training. Major muscle groups 2 times a week. So what I mean by major muscle groups are your legs, so your quads and your hamstrings, so the front and back, then your chest, your shoulders, your back, and your glutes and core. So getting at least, 2 times a week of those major muscle groups is key. That could look different for most people. That's the nice thing about strength training. You could do full body a couple days a week, or if you have more time, you could do upper body 2 times a week and lower body 2 times a week. So you'd spend about 4 days in the gym. You don't necessarily want to work the same muscle groups back to back. If you can give a day of rest in between, that would be great. Form is more important than how much you lift, so please don't injure yourself with this. A lot of times people aren't lifting anyway, so maybe just starting with body weight is or even like resistance bands is the way to go. Making sure you have a workout or post-workout meal or a pre-workout meal, something that has some protein and carbs in it. And again, I'd put down there, you can use anything that's going to give you some resistance, some weight bearing, some body weight, dumbbells, resistance bands, barbells, whatever you prefer. You can do machines. Um, but when our muscles are strong, that is going to help us stay independent. It's going to increase our metabolism. Things are going to feel like they're easier to do. So it may not seem like a big deal now, but as we age, it's definitely a huge deal. So, keeping our muscles strong, help with balance, prevent falls or fall-related injuries. Um, so anything we can do to help mitigate those risks. So this is just a list of strength training exercises by body part. So your quads, squats, lunges, jumps. I wouldn't necessarily recommend jumps if you have issues with balance. Step ups, again, if you have issues with balancing, maybe a low step or no step ups. Your hamstrings or your glutes, so these are like the back of your legs, glute bridges, deadlifts, RDLs, good mornings, hip thrust. A lot of times, if you are not comfortable working with dumbbells or barbell machines, will hit these major muscle groups as well. So shoulders, you have things like an overhead press. You could do pike push-ups or just regular push-ups. Chest, bench press, push-ups, dips, back. There's rows, there's chin-ups, there's pull-ups. There's all sorts of variations of these. These are just like the most simplistic way to put them. Core, you could do planks, crunches, mountain climbers. Um, really just keeping it as simple as you can to stay consistent is the name of the game. But there are all sorts of websites out there, even YouTube. You can look up if you are unfamiliar with some of these moves, and you can look up how to do them. There are a couple websites, like I am an ACE certified health coach, and they do have a exercise library that you can access. I would be more than happy to send that your way if you want to know more about it. They have that exercise library. It's broken up into different body parts, as well as showing short videos or pictures of how a lift is done. So again, this is just like a quick reference sheet of those major muscle groups that I mentioned. So let's talk a little bit about exercise regressions, just because it's super important if you have issues as you age, or maybe you're just not or you're at a beginner level. Doesn't mean you can't do anything. It just means you might have to regress a little bit as far as some of the moves you're doing. So changing the angle of your body is an easier one. More upright is going to equal easier. So for example, if you can't do a push-up on the floor, you might have to change the angle of your body. So you could put your hands on a bench, on a box, on a wall, anything that you can do to make that a little bit easier. And you can do that, even on your knees, you can change it and make it a little easier that way. But it doesn't have to be just push-ups that you change the angle of your body. So impact, I mentioned earlier, taking out things like jumping. As we age, jumping can get a little bit more difficult, and it can be a little harder on our joints and our knees. So you could take out jumping, you could march instead of doing like high knees. Some people will do burpees, they'll step instead of jump. Jumping jacks, you can step instead of jumping as well. You could do things in a pool, which would certainly reduce the impact and be a little easier on your joints. The next one there, decreasing your range of motion. So this would be like reducing the height of a step. So I mentioned step ups earlier. Instead of doing it on a bench, can you do it on a shorter box? Instead of doing a full squat, you could squat down to a box. You could pull barbells from different levels instead of from the floor. So lots of different ways to decrease that range of motion, or you could use a machine, which would definitely help with the range of motion. Stability, using a chair or a wall. So you could hold on to a chair if you wanted to do a lunge. That would reduce the amount of balance you would have to use until you get a little more comfortable. And then same thing, use a machine. It's going to help with um, you're going to be working out the same body part and you're going to control that range of motion and the stability a little bit better. And then reducing resistance, using lighter weights, doing body weight, doing resistance bands, trying a different movement. So I mentioned, for example, rows. There are so many different ways you can do a row. So it might just take doing some trial and error to see how some of these moves feel. And if there's a better way to do it for yourself to help you feel more confident. So balance and mobility, I already mentioned balance exercises help prevent falls. Um, this type of thing, I'm, 2 to 3 times per week is okay. If you can do this type of stuff daily, that's even better. But things like Tai Chi, standing on one foot, a heel to toe walk, balance walking, standing from a seated position, these are all great things that will help with balance. And then stretching is going to help with your flexibility. Moving more freely will make it easier for you to remain independent. So, like reaching down and tying your shoes or looking over your shoulder when you're backing out of the driveway. Again, this is something you can look up on YouTube. My Ace Fitness library I was talking about will have stretching in there too. There's all sorts of free resources out there for you, or you can join a class. I'm sure there's a yoga studio here in town, so you could go to something like the yoga studio, or maybe you can join the Y. So let's get into how exercise changes as we age. So in our 30s, we should be doing most of the recommendations. So resistance training at least 2 to 3 times a week. So that'd be the strength training, cardio almost every day if you can manage it, getting your heart rate up. If nothing else, walking. We are, in our 30s, probably starting to realize that um, it's getting a little more challenging to do things. And we're also busier. So we're kind of in the height of our career, maybe starting a family. But if we're not regularly exercising, we're going to start seeing how maybe our heart rate, increases, our endurance starts to decline. So we're going to have an increased risk for heart disease. You'll start to experience muscle mass loss if we're not doing any strength training. Men in their late 30s are going to start experiencing lower levels of testosterone, as well as belly fat. So strength training is going to increase that muscle mass. That's going to help with weight loss. Women in their 30s should be doing strength training because it's going to help with elevating levels of human growth hormone, which can help with metabolizing fat and increasing muscle growth. So anything you can do in your 30s to get into a good routine of adding exercise will be very, very helpful. So in our 40s, again, you're gonna start realizing that it's longer to recover on some of these things. So this is where it might be important to just do the small bouts of exercise because I get it. Our routines are busy. We have families, we have kids, we have a lot of obligations that we're trying to do. So any way that you can fit that in, even if it's a 10-minute walk 3 times a day. So again, continue the strength training and the cardio. Consider incorporating high intensity interval training because it's just going to help with muscle building hormones or promoting those muscle building hormones. It's going to help with, losing weight, yoga to improve overall flexibility. So we're kind of starting the foundation of what we need to be doing as we age. And I do want to put there that adequate sleep is very important because muscle building hormones are produced during REM cycles. So many people, when I talk to them during coaching, do not sleep well, or they tell me that they can function on 4 to 5 hours of sleep. And while that might be true that you can get up and function the next day, it's still wreaking some havoc on your body. So if I can get you to even think about your sleep a little bit more, that would be something to, just food for thought. In our 50s, so Very important just to make sure we're doing things we enjoy and that we can do consistently. It's still it's still okay to be doing, resistance and cardio training, uh, the resistance training at least 2 to 3 times a week, or the cardio, 150 minutes per week, or at least trying to get somewhere daily with it. And then still adding in that high intensity interval training. The one thing that maybe we should start doing in our 50s, though, is starting to learn new movements, because it's going to stimulate our brain development. So that can help with our memory as we get older. Um, so it's just, I guess, what's happening when we're learning those new skills. It's developing new neural pathways in our brain. So that's what we want to be happening as we age. So that's kind of the main thing here is, you can still continue to do the things that you enjoy, but maybe consider adding in something new. In our 60s and our 70s, so continue to try to learn new things, or at least challenge ourselves. If you are feeling a little, unbalanced, maybe not as confident, consider moving from free weights to machines. But also, if you are feeling the effects of maybe arthritis, so those machines will help with reducing stress on our joints. And again, it's very important to make sure that we're just exercising somewhere daily. It doesn't have to be strenuous, but movement daily. You can, even add in or still continue to do at least one high intensity workout. You don't really want to go too crazy on those as we start to age. And then in our 70s, this strength training becomes even more important, which was kind of a surprise to me, I guess, when I was reading through some of these things. But um, I've mentioned time and time again in this presentation, it's going to help with remaining independent. It's, almost more important than the cardio when you start to get a little bit older here. Continue to do the things that you enjoy, but use those machines, even those small free weights. Listen to your body. Don't push yourself too much. And then these movements that are going to help with flexibility and balance and coordination, like yoga, tai chi, or dance, are very important because it's going to help with reducing our risk for injury. And in the 80s and beyond, this lady is 80. She has been exercising for a long time though. That's why she looks the way that she looks, because she's been very consistent. Most of us is probably the extreme example, but do anything you can as often as you can, anything you enjoy. So resistance training continues to be especially important because it's going to help with remaining independent. And then again, continue to do things that are new because it's going to help with developing those new neural pathways, which is going to help with memory loss. So the last part here is just looking at how to put together a workout and then some sample workouts. Okay, so putting together a workout, you need to think about how often you're going to be exercising. Is it going to be 2 times a week? Is it going to be 5 times a week? 3, whatever, you have to look at your schedule. So whatever makes sense for your schedule. Is it going to be certain days I'm going to do like my walking a couple times a week, or I'm going to go to the gym these days? Sometimes it may require you to just look at your schedule weekly and see what even makes sense. Length. So again, that can go back to, I have an hour lunch, so I can go to the gym for 30 minutes. And that, includes some drive time in there. So at the end of all that, it might end up taking you the full hour. Or I'm really busy this day. There's no way I can go to the gym, but I can walk during my lunch break for 30 minutes. So again, it may just take some finagling of your schedule to see what works best. So cardio type or exercise type, and then what types of strength training exercises would you like to do, and the rep scheme of that. I'll get a little bit more into that as we move forward. but that can change dependent on what your goals are. And then recording and evaluating. This part, maybe not necessary to do, but it's nice to see your progress or nice to see where you have been and just getting an idea of what you like and don't like. So maybe you tried something and you recorded it, and as you look back on it, you can evaluate and decide how you like to change it. And then being flexible. I've gotten into this a little bit just with looking at your schedule. My week is never the same, so I'm usually looking at my week all the time and having to decide, am I going to work out Tuesday, Thursday this week, or am I going to work out Monday, Wednesday? Am I going to walk at night or in the morning? So you have to take, this and just kind of roll with it a little bit. So setting goals is just going to help with direction. And the more you can make it a SMART goal, the better. So specific, measurable, achievable, realistic, and timely. There's a difference between I'm going to start walking and versus the goal, I'm going to start walking this Friday and I will walk 4 times a week, 30 minutes each time, and I will do this for 6 weeks. So the more you can figure out why things are important to you and what your goals are, maybe the more accountable you're going to be to those. So I do encourage you to set goals, even if you're not a person that likes to set goals. This is where even if you don't hit your goal, you can evaluate it and see what might make more sense. So let's look at some sample workouts. This is a full body workout. Depending on your schedule, you might have to combine your cardio workout with your strength workout. If you have a lot of time, then you could probably get away with doing cardio on certain days and strength training on another. I've even had some people do it twice a day, so like cardio in the morning, or their walking will be their cardio throughout the day, and then they'll go to the gym and strength train. So again, this is up to you. But some of the key things that you want to make sure you're doing is warming up and cooling down, even if it's just like a couple minutes. On this full body workout, you can see that you're lifting major muscle groups. So when you look at the exercises, you see shoulders, your legs, your chest. So you see lunges and squats there. Rows will hit your back, and RDLs are going to hit the back of your leg. So you can see 3 sets by 8 to 10 reps. The sets and the reps can change dependent on your goals. I don't want to get too much into this. If this is something you're interested in, please let me know and I can give you more information. But generally speaking, anywhere between 3 to 4 sets at 6 to 12 reps is a good range to be in. Really what you want to do is the last couple of reps should be hard for you to do, but not where you fail. If you're failing fairly quickly on a weight, then you probably need to bring the amount of weight that you're lifting down. And if you're getting 12 reps super easy, probably need to increase the weight just a little bit. If you're not doing a whole lot right now, maybe just start with body weight. Get the feel for the movement down before you just jump into it with a heavy weight. You can use a machine instead. This I just have, listed as like a dumbbell workout, but machines will all hit the same type of lifting there. You could, like I said, add a cardio element after instead of a cool down, depending on how much time you had. And you could do this 2 times, even 3 times a week, and get the benefit of the strength training, the recommended amount. And you could take those exercises and do different variations, but I'm kind of a person that is always going to say, keep it simple and be consistent with the simple stuff. There's no magic scheme of exercises. It's more about being consistent and showing up for yourself regularly. So here's an upper and lower body split. Again, this is something that would probably be what you would do 4 times a week, because you would have to lift upper body twice and lower body twice. If you could only get in one upper body and one lower body per week, go for it. There's nothing saying that you have to do the recommended amount in a week. You're just going to see more benefit if you're hitting that recommended amount. So I don't want to defer you or deter you from getting in some strength training, even if it's, twice a week on upper and lower. So same thing, there's a warm up and a cool down. You could pair the cardio in there somewhere. You're gonna be hitting hitting your major muscle groups on both of these, and you can see the sets and the reps are about the same. But you're gonna be able to do more for your upper body and more for your lower body if you're just focusing on those. I would not do more than 6 exercises. I'd even say 5, but I added core in there. So if you are doing, you can get a good workout in with 4 to 5 exercises, especially when you're lifting major muscle groups, because they're going to be getting into um, the other muscles. So like for example, a chest press or like a bench press, you're going to be working out other parts of your arm, like your biceps. Even like a lat pull down is going to work on things, or not a lat pull down, I'm sorry, like a row is going to work on your triceps. So you can get benefit from those other exercises. So other behaviors to consider when it comes to aging, because they do play a big role here, is diet. So something that's rich in fruits and vegetables, whole grains, high fiber foods, lean sources of protein. You want to make sure it's low in added sugar, salt, and unhealthy fat. That's a general diet. That's what's recommended generally for most people. So if you're doing that as you age, that's great. Some other things to think about though when it comes to our diet is making sure we're getting adequate amounts of calcium. So especially as we age. So you can find that in things like dairy products, broccoli, kale, salmon, tofu. You could talk to your doctor about a supplement if you're finding it hard to get it in other ways. We also want to make sure we're getting enough vitamin D. So you can get vitamin D from sunlight, but food sources would be tuna, salmon, eggs, vitamin D fortified milk, or supplements. And then just making sure we're drinking things like water. There is evidence that a Mediterranean style diet can help with dementia. So Mediterranean style is going to follow a general diet, fruits, vegetables, whole grains, but fish is going to be a little bit more in there. Olive oil, healthier fats are going to be in there. Don't smoke. So smoking does contribute to the hardening of our arteries. It increases our blood pressure and our heart rate, among other things. So we've already realized, or we've already talked about how heart disease is a common aging problem. So we don't want to contribute to that even more by smoking. Stress. So stress again can take a toll on your heart, our mental health. So the more we manage this, the better. So doing things like exercising, going to a therapist, meditation, doing things we enjoy, anything you can do to mitigate that stress. I talked briefly about sleep, but just make sure we're getting enough sleep, because quality sleep is going to play an important role in healing and repairing our heart, our blood vessels, and producing muscle, growth hormones. It messes with our weight, it messes with our appetite and hunger hormones. It can mess with diabetes. If you're not sleeping well or sleeping long enough, it just can wreak havoc on your entire body. Staying mentally active. So we talked a little bit about this too, which is learning new skills in the exercise realm, but this applies to pretty much anything. If you are doing, new skills in general, whether it's learning a new game or learning an instrument, learning a language, um, a new hobby, taking classes, whatever it is, it's going to help with that memory loss that we can experience as we age. Being social. So social interaction is going to help ward off depression and stress, which can lead to memory loss if we're not mitigating it. So this could be like volunteering, it could be spending time with friends and family, attending social events, anything you can do to just get out and around others. And then I do need to say, just make sure you are going to the doctor, getting age-appropriate testing done, getting a physical, going to follow-up appointments, whatever you need to be doing with your doctor, making sure that you're following through on those. So I've talked about, lifestyle and inactivity is the culprit behind America's poor health. So transforming our lifestyles can be the cure. So I went over a lot when it comes to exercise and how important it is, and hopefully I've convinced you a little bit to add it in as much as you can to your day. If you have any questions, feel free to email me at ktam@logansportmemorial.org, or you can call me at 574-725-2012, and I'm option number 1. Thank you for listening.